Hey guys, I am here with Dr. Crystal Draper. I am Millie Fox. We are talking today about how to have a pain-free pregnancy as much as possible. And Dr. Crystal is a chiropractor specializing in prenatal and pediatric care. So I'm going to hand it over to Crystal to tell you a little bit more about her background and why she is the most qualified person to talk to you about this topic right now.
Hi, everyone. Like Millie said, I'm Crystal. I'm a chiropractor here in Toronto. My practice is family-based, but my focus is pregnancy, postpartum, pediatric. And I practice here in Toronto. I also teach at the chiropractic college here, as well as do research. So it really is a passion for me. So really helping mamas out and mamas and babes.
So that means she really knows what she's talking about, guys.
Here's hoping.
Yeah, I have firsthand experience. I'm 29 weeks pregnant at the moment, bump shot, and I've been coming to see Crystal for, I don't know, a couple months, I think, almost. And she's been helping me out with hip pain and rib pain and back pain and all these good things. So what we're going to do today is take Dr. Crystal's 5 top tips for how to stay pain-free in pregnancy. And we're going to dive right in with tip number 1. So what do you got for us?
Yeah, tip number 1 is sleep. So sleep is so important for everybody, but I find in pregnancy even more so, right? Because you're growing a human, but a lot of times women who are pregnant, they find that it's disrupted. And that's because there's lots of bathroom breaks, or they might feel uncomfortable and rolling over. It can cause that discomfort, wake them up. Have your pillows, have your supports there. So I think you have a pillow that you really like. Is that correct, Millie?
Yeah, I have the U-shaped one that goes all the way around your entire body, and it was like prime for me with my first pregnancy. And this pregnancy I've added even more. So now I have an extra blanket tucked under my bump, and I have an extra blanket or a pillow from my knees to my ankles, because the U-shaped pillow only goes down to your knee. So I need an extra one for down there. And what else do I have? And then I have a third pillow, just like a throw cushion pillow under my one arm to keep me from like hunching in this way.
So, Pat, you've got the fortress built then.
You really full fortress, and it's so hard to turn over.
Yeah, because you have to like lock everything in and roll. You really hit all the main ones though. So you want one that is between your knees, and starting, when I say between your knees, you want to start at your ankles and then support into the inner thigh. So that's going to keep your pelvis in a nice neutral position. The other one, and as you get further along in your pregnancy, so it might not be as necessary for someone who's in their first trimester, but into your third trimester, like you, having either a pillow or a towel rolled up to support the belly, especially for having anything like round ligament pain.
The ribs is
rib pain. Yeah, exactly. And then it's always great if you have a body pillow or a pregnancy pillow you can hug, so that it's not going to roll you forward. Also, if there's rib pain. And one that you don't want to forget about that I find is very common for people too is a nice supportive neck pillow. And sometimes with the pregnancy ones, if they hook all the way up, it's either too high, like too much support, and it's tilting them into a flexed position in their neck, or not supported enough. So you still want to make sure that you've got a really nice, good neck or cervical support there as well. Okay. Some women find the pillows behind too to avoid that rolling over. So
yeah, I tuck the back portion under my back hip so that it I don't know what it's doing, but it feels good.
Yeah, it would just give you more support, right? Because your center of gravity is shifted forward. So it stops that rolling motion.
Yes, and we're spending hopefully like 8 hours a night in bed, right? So it's important to be in these optimal positions to avoid straining certain areas, so that during the day we have less pain, right?
Exactly. And it's one thing that I think most people underestimate is the power of sleep and that sleep posture. But you, like you said, you're in it for such a long period. Having ideal posture for that duration is important.
And trying to be able to get more sleep.
Yes, as comfortable and as long as possible.
The struggle is real in the 3rd trimester.
Yeah. Yeah.
Okay, that's awesome. Yes. Build the fortress. If you have to kick your partner out.
Exactly. Take over the entire bed.
We're still doing pretty well, actually. My husband likes to snuggle into the side of all my pillows, so he's doing okay so far. But we did remove the toddler. No toddlers allowed.
You got the boot.
Okay, so tip number 2. What do we got?
Tip number 2 is posture. So we talked about sleep posture, but yeah, exactly. Now we're going to talk about posture throughout the day. So I guess it's not shocking that a chiropractor is going to preach on posture, but again, it's really important in pregnancy because your center of gravity is shifting forward. So as the baby grows, the belly grows, and it pulls mom forward, you start to get a larger arch in your low back, and that can cause some extra strain through.
So I'm just going to stand up here for a minute.
Perfect.
So this is what you're talking about, like hips back.
Exactly. So you can see that shift in your center of gravity forward, which then creates that what we call an increased lumbar lordosis, which can put more stress and strain through the low back and the pelvis.
So we want to be having a neutral.
So we want to do a little bum tuck. We want to tuck the bum under, or what we call a posterior pelvic tilt. Yes.
So if I'm from here and I go there, that's neutral, right?
Yes. And then you want to pull your shoulders back as well. Good.
But I don't want to go too far tucked under, right?
No. So you want to find that position where it feels comfortable, what we call neutral spine. So we don't want to be too far tilted forward or too far tilted back.
So for parents who already have another child, like a toddler or whatever, you could have that tendency to tuck under a little bit more when you're like lifting them and stuff like that, right? So even when you're lifting your toddler, because you and I had talked about that at one of our last appointments, that I was experiencing some pain, both in my hips, but then also in the front of my belly too. And I think you had mentioned something about the pelvis when I'm lifting.
Yeah, you want to keep the pelvis in a neutral position, and then what you want to do is you want to hinge forward at the hip when you're bending. So for you, I think you were really breaking that neutral spine as you flexed forward versus keeping it locked in and then bending like so. The other thing we talked about when you're lifting, if you have a toddler, is it's very common to lift and hold on one side, and then you were getting like the little hip hike like so. So then you can see that tilt.
Which is why I was having, and still are having, more pain on one side than the other.
That's very common with parents who have toddlers. Yeah, things that we want to keep in mind.
Mm-hmm. So neutral pelvis and then shoulders back.
Exactly. And you can do a little chin tuck too, so that we're not, especially now, like we're on our phone so much. So we tend to be looking down, and that really encourages that forward head movement, which we don't want either. So doing a little chin tuck, shoulders back, and a little bum tuck to make sure that we keep our neutral spine.
Oh, and I think the one thing that you had mentioned in the last time we chatted as well, you had said cues for remembering.
Yeah, so having some kind of reminder in the day. I always find that to integrate these habits, it's always good to get into a routine. So whether, for example, when I do chin tucks, if I want to do a posture check, I'll use something like driving. So when I see a red light, I'll pull my shoulders back. I'll even do a little chin tuck into my headrest. Whether that be if you are going to bend over, what I usually will say is like do a posture check before you bend. So make sure that you do a bit of an abdominal brace. You're going to hinge forward at the hips. Something that is going to remind you so that each time you go to do a movement that's aggravating, you're going to do a posture check or something in your house or something that reminds you. You can even set, worst comes to worst, set an alarm on your phone every 30 minutes, every 60 minutes to take a check-in.
Do a posture check. Yeah, it's something that you definitely need to constantly be reminded of, because your body, like your stomach is kind of just pulling you in certain ways, and you're kind of compensating. So
yeah, exactly.
That's helpful. Okay, so we just covered tip 1 and 2. Now we're on tip 3.
Tip 3 is stay active. So this can be walking, this can be going for a swim. Swimming is great because it helps to take pressure off of the joints too, especially when you're pregnant. Cycling on something like a recumbent bike, so something that's stable and secure. I know you've been really active throughout yours, so keeping up the activity. The current guidelines are 150 minutes over a week, and that's 3 days minimum. So if you do like 30 minutes, 5 days a week, that would be something that's ideal. You can also do some resistance training, but just remember that the caveat is that as long as you're having a healthy pregnancy, that there's no contraindications or there's no complications with your pregnancy.
Mm-hmm. And given the current situation, as we are in the middle of the COVID-19 pandemic and we're all at home,
Yeah.
not able to go do our normal things, I definitely have some recommendations in terms of online programs, online fitness programs that are specific to expecting and postpartum moms. So I'll link those down in the description. They actually currently, if you're watching this during this pandemic situation, they have a free online trial that's open as long as this pandemic's going on. It's called the Mama Reset.
Oh, great.
There are some Toronto-based ladies as well, but it's all online videos that you can access to keep active in your home without needing any equipment or anything like that. So
yeah, that's fantastic.
And staying active helps with pain because
it's just good to keep as you're active, your muscles are going to stay nice and malleable. Your joints are going to get movement. Your joints love movement. And keeping active, you're going to build up that endurance too, right? So you want to be staying active through all of your trimesters, again, as long as it's safe, because as you go through first into second and third, we know that there's weight gain too. So as that adaptive process happens, you want to make sure that you're staying nice and strong and fit in order to support baby and stay pain-free.
Makes total sense. Okay, good one. And we've got 2 left, so let's move on to the 4th tip.
So fourth is stretches and exercises. So that's kind of a continuation from our last one. And this is things that most people, women during pregnancy, the prevalence rate, the statistic is up to 90%. So that means that 90% or up to 90% of women will experience low back pain, pelvic girdle pain during pregnancy. And that's just because of these changes we've talked about. So that shift forward, that weight gain, etc. So the stretches that we're focusing on are really going to be isolated to that region. People know it as a cat-cow, but in pregnancy, I like to go cat to table. Okay. And so what we're doing is we're going up and we're arching up into that cat position, but then instead of dropping down, we're just going to our tabletop or our neutral spine. And that's really important when you get later into second and into third trimester, because we don't want to pull forward. Remember, we talked about that forward shift in our center of gravity. We don't want to facilitate that, right? So we want to go back to we want to end in our neutral spine position and then stretch and counter that forward pull by doing our cat stretch. Number 2 is going to be a child's pose. A child's pose is really good at elongating those muscles of the low back and help to stretch out. Some women find, though, that as they get into second and third trimester, and again, the bump is starting to grow, that it feels a bit uncomfortable. So if that's the case, I always suggest putting some pillows that you're going to be stretching out onto, or using an exercise ball. So you're still getting that lengthening effect, but you don't feel like pressure or compression on the belly.
And just, I guess, opening your knees a little wider would help.
Exactly. So your V position is going to be wider, so that, again, making space for the bump.
And in terms of how often should we be stretching, or for how long should we be holding these stretches?
Yeah, so stretching every day, I would say. So a great routine would be go for your walk, do your activity, and then sink into your stretches after, because muscles always like to be stretched when they're warm. We don't want to stretch cold muscles.
How long should we hold them?
For how long, you always want to hold a stretch for at minimum 30 seconds. Child's pose is no problem, right? Child's pose is so relaxing. I find it's like one of my favorite restorative pose.
Yeah.
So I can sink into that and I can hang out there for a couple of minutes.
Yeah.
And as time goes on, to just inch a little bit further forward to get more elongation. But 30 seconds is kind of your baseline minimum.
Okay. And just so everyone knows, down in the description box, I'm going to put links to other little YouTube clips to show you exactly how to do these stretches. And then one more stretch that I wanted to ask you about for like hip pain.
Yeah.
I don't think we covered the...
So there's a couple for hip pain. I think we talked about previously hip circles. And pelvic. Yeah. You also like to dance and get your groove on. So
oh yeah, it feels so good. So an exercise ball.
You got it.
Both ways.
You can do circles. You can do figure eights. You can also do those pelvic tilts like we talked about. So you're basically just rocking, tucking your bum under.
Back and forth, basically.
Yeah, exactly.
Cool. And then for like upper body, other than like the cat table, or is it cat table, right?
Yeah.
Just to maybe open up the chest a little bit more, you can do the doorway.
Yeah, exactly. So find a door frame. You can place your elbows at 90, and then you're just going to let yourself sink in. And it's really nice to stretch and open this up.
A little chin tuck, yeah, because it's all pulling us forward, right? The big boobs and the
exactly. So you got it. A lot of women find that as their breast size enlarges and they might need to change their bra, they're starting to get pulled further and further forward. So that's a good way to counter and open up.
Every day, like once a day, twice a day?
Minimum once a day, but if it feels really good and you are feeling any discomfort, it's a great way to do some strategies at home to help.
Okay, and then another one for the hips that you told me. Well, I think there was two more. There's the
figure 4 is one of my favorites too.
Figure 4. Okay, so that's where you put one foot up onto your opposite knee and you lean forward.
Exactly, and think about putting belly in the hole, and remember, we're sitting up nice and tall again, and we're hinging forward at the hips. Exactly. Okay. Again, neutral spine, one of our key messages.
And then thread the needle.
So that's just a variation of figure 4. So if you're still comfortable on your back, then you can thread the needle and pull your thigh into your chest.
So that would be like, well, I don't know if I could even sort of like this, but then pulling on this.
Exactly. Yeah, so that would be more first and second trimester. As third trimester goes on, it's probably going to be a bit more challenging, and the figure 4 in a seated position is going to be a bit easier.
Definitely. And then what's your call on like a runner's stretch or like anything for like the hip flexors?
So hip flexors, you can do a gentle Psoas Lunge. So you're going to go into a lunge position, and the muscle that you want to stretch, so the hip flexor, the psoas, is going to be on the back leg, and you're going to go into your lunge position, and then at the end you're going to do, so you would be stretching your left, good, and then at the end what you can do is your little bum tuck. So what you're going to, so you should feel it more isolated right at the front of the hip as you tuck your bum under.
Feel it in the back too.
So as long as, remember with stretches that as long as it's not causing any pain or sharpness or pinching.
No, it feels
so good stretch, even that little burning sensation, we like that, that's good. But sharp, pinchy, or exacerbating the pain that you're having, then ease off.
Avoid. Okay, and then I think we're at 5. What's our last?
So number 5 is to see a pregnancy specialist. So whether that's a chiropractor, a physio, massage therapist, any type of manual therapist that can help you, assist you if you are having any aches and pains.
Okay.
You can also ask recommendations from your birth provider, so whether that's an OB or a midwife, just to get some further information specific to your case and your pain presentation.
Okay, so as of right now, none of us can go to appointments. So what we can do is reach out to a chiro and see what they're offering, right? So you said personally that there's some stuff in the works that you might be able to start offering phone consultations and maybe even video consultations just to help people navigate things a little better than they would be able to on their own during this time, right?
Yeah, exactly. So phone consultations, shooting your chiropractor or your practitioner an email just to see if it's something that you guys can talk through, or an online video conference. So we can do something like Zoom or through our online booking system. It's called Jane, and they're starting to work out some options there too. So because this is all really new and recent, we are trying to navigate options so that we can still provide the best possible care for mamas.
Yeah, it's also really great going forward, like being able to learn to have these options for people who are remote or distance or whatever. If there's somebody like yourself and another person that lives too far away from the GTA to come see you, but they really liked you and they want to connect with you, they can always reach out, and we might as well tell everybody how people can find you right now.
So right now, email is great. So drcrystaldraper@gmail.com. I'm also, my website is drcrystaldraper.com, and Instagram, Dr. Crystal Draper. So
your email was dr.crystal.draper@gmail.com. Okay, and then the website's all one word, of course. Instagram is just at
Dr. Crystal Draper.
no periods or underscores.
No.
Okay. And now I'm going to talk to you for one quick sec about my situation and see if maybe this will help some other people too. So I've been seeing Dr. Crystal for the last couple months, but I haven't been able to come in for an appointment because of the current situation. What I'm experiencing is a lot of hip pain. Luckily, my rib pain is not too bad anymore, but it's the hip pain that's really getting me. So what's happening is when I wake up in the middle of the night and I have to go pee or I have to go see my toddler, or when I wake up in the morning, I can barely walk because my hips just feel so tight and it's just painful, and I feel like it's gonna like give out or something if I move my feet to walk too quickly without like waiting and like moving around in one spot for a minute. So if I'm doing my stretches once a day and I'm still experiencing this, what can I do at home to help myself get through this?
Yeah, so a couple of things. First, you just intuitively mentioned one already. So as you sit on the side of the bed, before you get up and move, do some of those movements we talked about. Do some pelvic tilts, do some rocking side to side, because that's going to get the joints and the muscles warm and limber. And then the other thing that you can do is an abdominal brace. What that means is think about your belly button. You're going to pull in just slightly, so it's not a full pull in where you're going to be holding your breath or sucking in your tummy. You're just doing a slight pull in. Think about giving a baby a hug.
So
Gentle
I
engagement.
was talking to a personal trainer who focuses on like healing diastasis recti and pelvic floor health and stuff like that. And she had actually mentioned to me to imagine it like you're bracing from the bottom up with the abs, like you're picking up a blueberry from your
Yeah.
underwear. And
So that's engaging your pelvic floor as well. So that's great.
that's the core, right?
Yeah.
So doing both of those together, now that I've like had that image in my head, I've actually found it easier to know that I am bracing my core properly, because before it was like a top down sort of brace where I'm like coming in like this way, bracing my abs, and then I guess the rest of it's kind of getting forgotten, like the bottom parts and stuff, because when I have this belly, it feels totally different to brace my core than it does when I don't have a belly, right? And I had just found that I wasn't sure if I was actually engaging or not, because I was trying to remember to do this, like when I was picking up my son and getting up and putting on my pants.
Yeah.
You got to balance and, pick one leg up off the ground. But I wasn't sure if I was doing it right. So having that visual of like the bottom up, like an up and in sort of bracing, that actually really helped me know, okay, I'm doing it now.
Yeah. The other way to test if you are engaging the pelvic floor, so what we call a Kegel, is that when you go to the bathroom, so when you are urinating, just once during your stream, stop your urination. So stop your stream, and that sensation, that is a Kegel. So that is that contraction, and then allow the rest to void. So just do it once. We don't want to cause any UTIs, but just to check in, to get that awareness. So then when you are going on your day, then when you contract and you do that pull up, like pulling up of the blueberry and engaging the belly, you can use that to check in that sensation is similar.
Yeah. And I pulled my shirt up and I stood in front of the mirror and I watched myself do it both ways, where I was just trying to like squeeze the top, like, the top abs where you just like brace your top abs versus the up and in. Yeah. And it was such a different visual, the way my belly looked when I was doing that. I was like, oh, okay.
And doing those things in front of a mirror is great, because then you see that visual feedback and it's a great cue to see. And then again, just checking in with how it feels so that you have that kinetic awareness for when you're doing your day-to-day activities.
Okay. Awesome. This has been a great conversation. So thank you all for watching. Again, go find Dr. Crystal Draper at Dr. Crystal Draper, drcrystaldraper.com, or I'm going to link everything down in the description. Please subscribe to my channel, turn on the little bell notification so that you'll know every time there's a new video, and give us a thumbs up. And the best thing you can do is share this video with a pregnant friend. So that's it. We'll talk to you guys later, and I hope you enjoy the rest of your day.
Thanks for having me, Millie, and everyone be safe.